I'm Dr. Jesse Schulz, physical therapist in Windmill, Wisconsin. Today I'm going to be showing you one great exercise for keeping your back healthy, and it's going to strengthen you in the frontal plane. The frontal plane is basically the plane of your body if you're standing against a wall or if you're doing a snow angel sort of motion. It's a side-to-side sort of control. And the windmill is a top-down strengthening exercise for your back muscles. And it seems to strengthen the quadratus lumborum muscle and quiet down issues with the quadratus lumborum. Now, how you do this to prevent yourself from injuring your back. It's important to keep your back straight as you're doing this exercise. It is too easy when you're doing this to get lazy, get too focused on reaching down to the floor, not towards, but to the floor, by basically bending your spine. Now, the key to doing this properly is to tilt your pelvis. You're basically lifting one side of your pelvis up while dropping down the other side. So as I'm bending to my left, right now this is bending my spine. But if I tip my pelvis as I bend to my left, up to this point here, my spine is straight. So that's the premise with the windmill. It is tipping the pelvis, getting those muscles on the lateral sides of your trunk to engage as you're bending over, which otherwise would bend your spine. Anytime your spine is not in a neutral position where it's not rotated or bent forward or bent back or not bent this way or this way, that's called neutral. Whenever it's not in neutral, you bear a greater risk of injuring your back with things, and that's why you're supposed to lift by bending your legs rather than bending by the back. So, what you'll need to do a windmill properly is some sort of weight, whether it be a kettlebell or some sort of dumbbell. You're going to put the weight over your head, and to make it easier on your shoulder muscles, your goal is to try to keep your arm vertical the whole time during this. You can put your other hand on your hip, you can put it on the side of your body, but it doesn't really matter, whatever helps you do this better. Now, you're going to keep this arm vertical, and I'm going to tip my body to the side. I'm reaching down towards my foot. I'm tipping my pelvis to keep my back straight, and about this far is as far as I can get, honestly. I'm trying to keep my arm vertical still. If it was vertical like I started, it'd be here. It always stays vertical to the ground, not to your body, and back up. Tip the pelvis, keep the weight vertical, come back up. Many times as you do this, you actually might feel that you're honestly getting closer and closer to the ground with a straight spine. And I think that's when your body's responding really well to this exercise. I'm going to put some parameters on the bottom of this video in the comments section for how often to do this, how many times to do this, so on and so forth, so you have some guidance. But this exercise, like any other, isn't necessarily appropriate for all people. So I would urge you to consult with your physical therapist or your doctor before doing these videos. I'll show you just a few on the other side, and before I close this video, you may find, like I have, because of some muscle asymmetries, you can't get as close to the floor with one side as you can the other. That's to some degree normal, but again, your goal with these is to keep your back straight, and a secondary goal is to touch the floor. But you're trying to reach towards the floor, though not to the floor. Many times if you're trying to reach to the floor, you're going to bend your spine. So, arm up in the air, straight up. Feet, I did mention this before, much wider than shoulder width. Not that you're trying to do a splits, but wider than shoulder width apart. Keep your spine straight as you tip your pelvis and reach over, and because of some muscles that are tight in my right leg, this is about as far as I can go honestly. Come back up. It's not always this tight. I worked out earlier this morning and I think I strained something. Try to keep your knees mostly straight as you do these. And now that I've got better control of my legs, you can see that I'm actually going over a little bit further. At the beginning, like other people I work with, some people are having a hard time keeping their knees straight, popping the hip out to the side, and or they're arching their back, and or they're bending forward a little bit. But in a nutshell, this exercise is simple. Keep the arms straight up in the air, keep your body in this frontal plane motion like you're standing against a wall. Tilt the pelvis, push the hip out to the side, bend over, reach towards the floor. That's it. Thank you for watching.